Welcome to Solomon Admissions. My name is Mummareddy, and I'm one of the medical school admissions consultants. Here at Solomon, we're always trying to provide you good quality advice for whatever academic endeavors you may have. Today, we're going to be specifically talking about the traditional medical school interview. We've prepared a presentation to help you ace your medical school interview, so let's just jump right in. So today we're going to be talking about the traditional medical school interview. I'll be talking about why medical schools interview in the first place, some general format for the interviews. Then we'll be talking about some general advice for the interview process. Then we'll be talking about the specific questions that are most commonly asked in these interviews. And then we'll go through some of the tips and tricks in answering these questions. So first, why do medical schools interview? I mean, you've already submitted all this information, your primary application, your secondary applications, your letters of recommendation, you've submitted scores, and you've pretty much laid it all out there. So why do they need to interview? Well, there's several reasons, and it's a two-way street. It's not only about them learning about you, but it's also about you learning about the school. So first and foremost, the interview is an opportunity and a platform for you to tell your story in a more convincing way, with emotion, with examples, with stories, and kind of really cement in the interviewer's mind your motivation for becoming a doctor and hopefully getting you an acceptance into that medical school. The second reason is to assess some of your skills, not necessarily how knowledgeable you are in medicine or how good you are surgically. This is to more see your communication skills, your social EQ, and adaptability. Medicine is a people-centric career. Every day you're going to be meeting 15, 20, if not more, patients, family members, colleagues, students, residents, and you'll be placed in a lot of different social scenarios. And you need to be able to adapt to these scenarios and be a leader in all of these scenarios. And so this is a way to see if you're capable of doing that. I'm sure all of you have seen the AAMC grid with the GPA and MCAT score, and you always see that there are some students who have the highest MCAT score and the highest GPA, but they still don't get into a medical school. And usually it's because they don't interview well. And it may be due to poor communication skills or them having some red flags that are picked up on the interview. And then the last thing is the medical schools want to recruit you, and they use this interview as a tool to do that. In any interview day, about 25% to maybe 50% of the day is the actual interview, and then the rest of the time is the students are meeting the current students, current faculty, looking at various lab spaces, simulation centers, and then learning about the city so that the medical school can recruit the students. Then there's different types of formats for these interviews. We're going to be focusing on the traditional interviews, which is what you typically think of in an interview format, which is one-on-one discussions with a faculty member or a medical student in the school, and these typically last anywhere between 30 to 45 minutes. They can be open file or closed file. Open file meaning they know your whole application and they've read through your applications, your letters of rec, they know your score. Closed file meaning that they haven't had any access to your application. And it's a way to prevent any biases that may arise. And typically you'll have 1 to 2 interviews per medical school. The other format is multiple mini interviews. These are short stations, can be anywhere between 6 to 10, and they each last for like 5 to 10 minutes. And each station will have a different prompt. Maybe one station you're working with one of your peers to build a Lego. The next you're working in a simulation center and talking to a patient. The next one may be ethical scenario. And so you just go through those stations. We're going to make a separate video about the multiple mini interviews. And in this video, we're going to focus specifically on the traditional interview. And then the other format is a mixture of both the traditional and multiple mini interview. Some general advice regarding this interview process. First and foremost, congratulate yourself for getting an interview. You've done an extensive amount of work from your undergrad to any time off you've taken, to putting together the primary application, submitting secondaries, and finally you get an interview. This is probably the first real confirmation and progress towards your journey to becoming a doctor. Up until now, most people get secondaries, and this is the first real vetting process a medical school does. And once you get an interview, your chances of getting into that medical school have significantly gone up, maybe going from sub 10% to maybe even 40 to 50%. So congratulate yourself. You've put yourself in a very good position. Now, you need to become familiar with that school. The schools usually send out an email and talk to you about what their interview day looks like. So learn more about the interview day, learn about the school, learn about the city, learn about the faculty. Some schools release who you're going to be interviewing with. So learn about those interviewers. Next thing, this is a professional interview. So always dress professionally. This is not the time to make a fashion statement. So generally, dark colored suits go really well. Have watches, ties for the gentlemen, and then dress nicely and professionally because you want to make a positive impression with all these interviewers. Next thing is always have positive vibes. What do I mean by that? Well, you may have different experiences getting to the interview, or have had a terrible day before, or the terrible night the night before. And when the interviewer asks you, hey, how's your day been going? Or how was your travel here? This is not the time for you to tell them about how your flight got delayed, then the cab left you, and then you had nowhere to sleep last night. It just starts the whole mood off in a bad way. This is a time that you want to have positive vibes, have a lot of energy, because that brings the energy to the interviewer as well. And then when the interviewer goes to write their comments about you, they just have a positive mood. And I think overall that serves you better than any negative energy. Next thing is body language. When the interviewer is speaking, and if you have poor body language, that's noticeable. Whether if you look disinterested, or not concerned, or if you don't look passionate about medicine, that can be seen through the interview. So always have good body language, make good eye contact, give a good firm handshake before and after the interviews. And lastly, practice, practice, practice. This isn't something that just happens. This is a skill that you need to work on, and you need to spend time doing mock interviews, maybe standing in front of a mirror, seeing how when you deliver answers, how you look and how you sound. And with practice, you will get really good at performing interviews. So with this knowledge, I wanted to kind of go over the different common questions asked in the traditional interview, and then just talk about each one of them a little bit. So the first question is, tell me about yourself. And I think this is a very simple question, but it's a very powerful question. And this is where many students can really trip up. And the reason why students trip up is you're trying to summarize your whole life into maybe 30 seconds or a minute. And it can be challenging. And what students do when they get posed with this question, they ramble. They talk about a lot of different things, and they take 5-6 minutes, and the interviewer kind of loses interest after that. And this is not a why medicine question. You don't need to launch right into how you wanted to become a doctor all your life and how you've shadowed and how you've done research and how you had this experience and that experience. This is the way I like to think about it is like a trailer for your life. Imagine your life as a movie. This is a short trailer. And once you master answering this question, this is actually a question that you will want to be asked, because then you can kind of guide what the conversation is going to be like. So talk about yourself, talk about where you were born, what's your family life like, what are your hobbies, where did you study, what are some of your favorite things to do. And in that way, the interviewer will also just continue the conversation. For example, if you said like, I'm an avid tennis player. I've been playing since I was a child. Maybe the interviewer is a tennis player, and then you have a conversation about tennis. And that way, you both have a good relationship that starts, and then your conversation flows much easier. So this is a question that I would spend a lot of time on in terms of kind of thinking about how to answer this question. You don't want to rehearse it so much that whenever someone asks you that this question, that you just sound like a robot. But you want to know generally what you want to answer with this question. The next common question is why medicine? And I would say this is probably one of the easiest questions that you can get asked. That's because you've already done all the hard work. You've written the personal statement, and the personal statement is, why did you want to become a doctor? And so all you have to do here is rehash why you wanted to be a doctor. And this is not the time to sway away from the personal statement. It's okay to rehash what you've already written, because your reasons for entering into medicine shouldn't change between submitting your primary application to the interview. And while you do this, show your passion, show your enthusiasm, talk about maybe a favorite patient that you've interacted with, or talk about uh, interaction with your family members that led you into medicine, or some research, and show passion with this. And that really carries weight when you can see that the student is very interested in what they're talking about. The next questions is, what is your greatest strength / weakness? And typically med schools just ask for one, but I advise you to have at least 3 strengths and 3 weaknesses, just in case they ask you, okay, tell me another strength or tell me another weakness. So this is something that you need to do some introspection and see, what are you really good at? Is it that you are a good communicator? Are you very reliable? Do you work really hard? Are you very organized? And have examples. So if someone asks you, what is your greatest strength? Don't just say, I'm a good leader. Give an example. And that way it's more memorable. Maybe you're a good leader. You led your baseball team to the championship, or you led a school classroom full of students to winning the Science Olympiad championship, or something along those lines. For the greatest weakness question, definitely do not try to hide a strength as a weakness. Definitely have seen students kind of say like, "Oh, I work extremely hard," and they kind of try to sell it as a weakness. That's not a weakness. That's a strength, and everyone knows that. And so you really want to have a genuine weakness that you have come up with. And the key here is to also talk about avenues that you are working on improving your weakness, and what all are the steps that you've made to improve on it. The next thing is that any activity, anything you write on your application is fair game for questions in the interview. For example, when I was interviewing in undergrad, I did research in an immunology lab, and I sat in front of this interviewer. And the first question they asked me was, "Oh yeah, I do research on this inflammasome complex as well. What do you think about the interleukin alpha?" And I was shocked. I bet I was also sweating. So this is something that you want to be very familiar with your application. I would say look through your application the night before and be ready to answer any question about it. And especially if you have some publications and high impact factor publications, researchers are going to see this and they want to know more about it. So just be ready to answer anything that's in your application. So the next one, tell me a joke. So this is not a common question that interviewers ask, but I put this in here to say there are interviewers who will try to throw you off your game. So you're kind of chit-chatting, maybe you're talking about breakfast and how the chicken biscuit was really good and whatnot. But then they're like, hey, tell me a joke. And this question is not so much are you going to tell them a funny joke, it's to see how you react to pressure. And what my advice to you on this is don't panic. And it is okay to ask for time. It's okay to say, hey, that was a very good question, and I need some time to think about it. And that is a mature answer. And this is something that you don't want to just kind of ramble and not answer the question. So just take an extra 15, 20 seconds, really get your thoughts straight, and then answer the question. The next question that can come up is why should we select you? And this is a good question for you if you've thought about what your pitch is going to be. Think of this as a short elevator pitch about all your strengths and why you should become a doctor. And this is going to kind of focus on what your strengths are. If you are if you want to become a clinician researcher and you've done a lot of good research, you can kind of summarize that and talk about how that's your future plans, how you want to be in an academic setting, and then make that pitch. In this question, do not criticize others. Do not go like, although other applicants may do this, but I do it better than them or something along those lines. This goes back to the original comment I said, do not bring any negative vibes into the interview, only positive vibes. And you just want to talk about yourself in a humble way. Next question, where do you see yourself in 10 years? This is a question just to see what your future goals and interests are. And you do not have to have everything mapped out. This is not a question to see if you know exactly what specialty you want to go into or what location you want to be in. It's just to see where your head's at. Some people come in knowing that they want to be like pediatric endocrinologist in Cleveland, Ohio, or something along those lines, and then they can say that. But if you don't know, that's fine. You can just say, hey, I'm not sure what type of doctor I want to be, but I do love teaching and I love research, so I want to be in an academic location. And my family is close to Tennessee, so I want to stay in UT Memphis or something along those lines. So this is just a general way to see where you're looking forward to. The next type of questions that you may run into are ethical questions, and there's a whole number of possible scenarios that can arise. One could be like, hey, there was a mistake done in surgery. Do you reveal the information to the patient or do you not? Maybe another scenario is, hey, you see your best friend cheating on the medical school exam. Do you report your friend to the administration, or do you just keep silent? Stuff along those lines. These are ethical questions because there's pros and cons to both sides. And I think the best way to answer these questions is talk about the pros and cons of each side and finally make a decision and back up your decision. Why did you decide to do what you wanted to do? There are some ethical principles that you need to learn about. The patient-physician relationship, non-maleficence, and various other principles that you should look up, which will help guide what you do in these scenarios. But the general rule of thumb is always do what is best for the patient And remember, medicine is a high integrity field, and you want to do everything with integrity and honesty. So those are general principles that will help you answer these questions. And lastly, almost every interviewer will end with, what questions do you have for me? And this is a time that you should ask questions, and don't ask any general questions that are easily searchable online, like, oh, what is the tuition? Or, what is the first year curriculum like? Ask deeper questions to kind of really understand whether you'd be a good fit or not. Maybe ask about what do the interviewers think are the pros and cons of this school? What do they feel is the trajectory of the school in the next 5 to 10 years? What makes a successful student in this school versus not? These are some of the common questions in the traditional interviews, and we've gone over some tips and tricks in answering these questions. So hopefully this was helpful, and we'll have more videos coming out about the multiple mini interviews and several other parts of the med school process. Thank you so much for your time. We hope you found this useful. Feel free to reach out to Solomon Admissions with any comments or questions.